people who are first in line to help students with a mental health crisis may not have the training they really need. So says new research from UVA. Kate Nectarline joins us live in the newsroom with what happens when a student goes to an emergency department for mental health reasons, but is then sent right back to school.
Aaron, if a student is considered at imminent risk of harming themselves or others, hospitals will admit them for psychiatric care. But what about the students who do not meet the criteria for hospitalization?
Way more kids are actually seen in the emergency department and then discharged home than the number of kids who are admitted for psychiatric hospitalization.
Laura Henderson Smith is an assistant professor at UVA's School of Education and Human Development. She says in some places, as few as 8% of the kids sent to emergency departments for mental health visits are actually hospitalized. The rest end up back in the hands of school mental health professionals.
They had all had experiences evaluating a student and feeling like what this child needed was beyond what they could provide at school. And then they refer them to the emergency department, and then the child is right back at school the next day.
Another barrier to providing care, Henderson Smith says, is a lack of communication.
If the student goes to the hospital or to the emergency department, the school may not know unless the student or their caregiver brings that information back.
Now, Henderson Smith is urging families, schools, and hospitals to collaborate and ensure that the needs of these students are met.
Even if we aren't able to talk about every single student that goes from the hospital to school or back, it's just having those proactive relationships in place.
Henderson Smith says she is now working on developing or adapting existing interventions and trainings that will help smooth the transition for both mental health professionals and the kids they work to protect. Live in the newsroom, Kate Nectarline, 29 News at 5.